used as an agent, specifically knowing the limitations of your buyers. Although we were the second highest offer, we ended up on top because of everything else that came along with the offer.
The first day walking in this house, and then I had my key going in, it feels good. If you are looking for someone to help you sell your house and buy a house,
people say I've got a great smile. Well, I have to say, this is all thanks to the professional team at Beacon Dental Group right here in Dorchester, Massachusetts. I've got world-class dental care. Beacon Dental Group has expert and caring staff dedicated to providing the most advanced and satisfactory treatment in all aspects of oral health. Their services are designed to meet your needs and give you a perfect smile, too. General checkups, cosmetic surgery, Gemini laser service, and advanced procedures, all in a state-of-the-art facility. Call or visit Beacon Dental Group today, 1026 Blue Hill Avenue, Dorchester, Massachusetts, or call 617-282-2146 for a smile that lights the world.
Where my parents are from, which are Castle Bruce and Grand Fort and Grand Bay communities, where we used to visit a lot on, sometimes on weekends, just to see family, which I still have a lot of family there. So I am from Dominica, born and raised, like many others did, my primary education there, my secondary education there, and what we then called the Clifton Dupany College, which at the time would give you a certificate. And then it was after that that I migrated to the United States. I enjoyed my time there like many others, playing. It was free. You're always outdoors. You don't have to worry about the winters. I am the middle kid. So I have a younger brother and an older sister, and we spent a lot of time playing, as well as, sort of invested in education as well, which I can talk more about. Right now, a few years ago, I'd say that I spend more time in Dominica than I spent in the United States, but this has changed more recently. So that's where I'm from, and that's where I continue to go back to whenever I get the opportunity to travel and go home and take my kids. My husband also is from Dominica as well, more specifically the Maho community.
Awesome. That's a quick and preview, but you covered so much. That's great. I love the idea that you understood that the education back home was great. You loved the freeness. You came to the United States, where I'm sure before you got here, people made it seem like it was a gold mine, and you just have to walk on gold. And of course, the reality, I'm sure when you came, there was not a gold mine in the sense that you would walk on gold, but there were opportunities that you could certainly take advantage of and enhance your career. So you came to the United States, and were you always interested in the sciences? Were you always interested in biology? Did you always want to be a doctor?
Yeah, definitely. I think I knew from primary school I wanted to be a doctor. I always had interest in biology and sort of how do the systems work, how what control things, and more importantly, how do we take care of our bodies. And I knew through my parents, we knew a few in the field. And like I always tell people, it never occurred to me that I could not be a doctor, because I saw people like myself be doctors. I always tell people I came from an island where the prime minister, when I was young, was a Black female. So I saw what it was to hold positions of leadership. And these are the things that I looked up to. So when I came to the United States, I came with the purpose of becoming a doctor. And I had researched somewhat at the beginning. I had a little bit of an advantage because my sister was already in the United States. So I had that advantage of sort of knowing how to try to navigate the system. I think the biggest thing is trying to figure out how to navigate the system, but not just navigate the system, but navigate it effectively. I always tell people one of the first things I realized after coming to the United States was that my skin color, I don't think I knew about that, or I was even taking a look at that before coming to the United States. But that became something that I realized quickly that people identified me by. So not only your skin color, but also the fact that you're an immigrant. And I had to take those two factors about me, and I really decided I was going to use it to my advantage. I was not going to make that a disadvantage to me. So I used it a lot in terms of getting to where I needed to get to from an education standpoint.
Well, that's great. And so, yes, I'm sure you encountered difficulties, you encountered roadblocks, but because of the background you had, where, as you said, the people that were in charge in leadership positions, the doctors, the principals, the presidents of the college, they were just like you. So in your mind, all you had to do was apply yourself and do it. And of course, your skin color could not be a limitation. And of course, I'm sure the fact that you had parents that were going to push you because they understood the importance of education certainly helped. Of course, I happen to know your family very well. Your brother, I believe, is a pilot, right? And we need to talk about that later. At some point, he might have to be on my program because I need to hire a pilot to take me straight to Dominica, one of the states. But yes, so you came and you saw and you delved into and you matriculated at the University of Massachusetts, right?
Yes, so I started off at the University of Massachusetts, and I knew, sort of fairly early on that getting to medical school was a process, and it was going to take a few years to do so. UMass Boston I chose because it was commuter friendly. I was able to live at home, save some money, work at the same time. I also decided that, trying to find ways to sort of cut the amount of time also that I was going to be spending. So I did a lot of classes during the breaks that we had, so the summer and the winter breaks. One of the things that I think was a good investment and use of my time was that I had a lot of people, I think, towards the end of UMass Boston asking me if I really wanted to be a medical doctor. For some reason, they thought that I wanted to do a PhD, and I kept saying to them, like, I don't understand why you think I want to do a PhD. So one of the things I did was something called a post-baccalaureate program, which is really sort of a year in between getting your bachelor's degree and then attending medical school. It's geared towards people who don't get a science-focused bachelor. So maybe taking the year to do the pre-medical curriculum, which I've done through medical school, through undergrad. But what do when I retire in Dominica. So I was thinking about retirement before I even got a job, because I knew that the chief epidemiologist at that time on the island was doing a lot of work in terms of public health. And I wanted to incorporate that. And I thought that was something I could take back home when I eventually go home. So I did graduate from Tufts with both my medical degree and my master's in public health.
That's awesome, and I think that's interesting because you actually went back to Dominica to complete your MPH program. Your thesis was you had to do with AIDS, HIV. Tell us a little about that.
Yes, so part of it was guilty pleasure of going home for the summer and spending 3 months on the island of Dominica, as well as taking advantage of giving back, right, to a place that had given back so much to me. Dominica is part of my village. So I went back and I got to work with Dr. Paul, the late Dr. Paul Ricketts at the time, who was the chief epidemiologist. And in Dominica, you always have a family member somewhere. So back then I could call my Uncle John at the time, who's an uncle of mine, and ask him if he could get me in with Dr. Ricketts. And within probably a day or so, I got an email saying, of course, come down, we'll work together. And it was a different process because, back then nothing was sort of computerized. So here I was going through for death certificates, doing the work, being on the ground, working with those in the Ministry of Health. And it felt very rewarding. It felt rewarding to do the work because you're actually doing the process of the work. And in the end, I was actually able to do a poster presentation and get a scholarship, some scholarship funding for that work, and send some of my results back to the ministry in terms of looking at something that's was very important at the time, which was HIV/AIDS and sort of the epidemic at the time there.
Oh, that's great. I'm just curious. You said your Uncle John. Is that John Tusem by any chance?
Correct.
Are you kidding me?
Well, John Fabian, the late John Fabian.
Okay, because I'm like John Tusem, because I know John Tusem was I think he's a vet down there.
Yes.
Okay, yes. Awesome. So great. And so you did that, and you got the scholarship. Let me get that straight, from Tufts, right?
Correct. Yes.
Okay, so they gave you enough funds so you could finish your project, and that was a success. And I hope they utilize that, and that's great. To whom much is given, much is required, and so you have a heart to give back to the community that helped you, and that's always a good thing. So I hope the young people that might be listening understand you don't just take, but you give back. And so, but now you are. So you went ahead, you did that, you finished your residency, I believe, at Boston University.
Correct, at Boston. Okay. The then Boston Medical Center. Yes.
Then you went on to do some work at Brown University. Tell us about that.
Yeah, so once you go, so I look at residency, sort of the training ground for after you graduate with your medical degree.
Right.
Once I was done with that, I wanted to specialize. I've always, through medical residency as well as medical school, had an interest in how the lungs work and sort of treating lung diseases. So I decided that I wanted to specialize in pulmonary, actually double specialized. So I'm specialized in both pulmonary and critical care, or what we call the ICU medicine. So I did that at Brown in Rhode Island for about 3 years before returning back to my now position, which is at the Beth Israel Deaconess Medical Center in Boston, where I'm an attending physician in pulmonary and critical care. So I still do both.
That is great. That is awesome. So I would imagine in pulmonary care that with the lungs, and that has to do with a lot of the COVID situation we're having, right? And so I'm assuming you're dealing with a lot of that. And we hear of all the different variants of COVID. Let's talk about how that has impacted you personally as someone who works in the field and see people coming in, and how has that impacted you as an individual, your family, and people in general?
Yes, it's been a tough year, like it's been for many of us. What happened, I think, at the beginning of COVID was that pulmonary sort of fell a little bit on the way ground, and critical care, I had to wear my critical care hat because at the beginning of the pandemic, like many of you know, there were a lot of patients in their intensive care unit. So that's the other place where I work. And it was tough, to say the least. I saw patients who range from ages as 20s to 80s on ventilators. At the beginning of the pandemic myself, I had to, again, like I said, it takes a village to keep me here. Because we didn't know much about the COVID at that time, I had to have my kids actually leave my house, and my sister and my mom basically had them for about 3 months. So my family was actually separate. So my husband and myself were together working because we're both first responders, basically. Mm-hmm. And my kids were being taken care of by my sister and my mom. And again, without them, I don't think we could have done this. And then, the vaccines became available, and the hope and, that came with the vaccines, you could see it among myself and my colleagues, and feeling that we're, sort of nearing what we call towards the end of the pandemic. Not thinking ahead yet of sort of variants. I got my vaccine early on because I still do work with COVID patients, and I did well after getting the vaccines. All my family, my adult family members, so people who are over 12, I encouraged them to get the vaccine, and several of my family members have gotten the vaccines as well. And part of it was so that we could come back together as a community, to be together as well, because we had stayed apart like many others for a number of months during the pandemic. And one of the things that I always get from patients and even family members is like, so how did this come about so quickly? And the vaccines especially, how did they do this so quickly? And I always tell people, like when you work in the field, it's easier to understand. Money drives a lot of things. And when you take all of the funds and the government decides that they're going to invest all the money that they have, especially in research, in developing vaccines, and that you have companies who are going to come together. So you're going to have collaboration among major companies to develop vaccines. There's nothing that's going to stop that. That can happen. We're seeing science at its best right now. So one of the things was like, for example, if I wanted, because my interest is in lung cancer and lung nodule management, if I wanted to apply for money to do that research last year, I was not going to get money. They were asking me, how are you going to incorporate that into developing something for COVID? That was how you got money, because everybody was focused on getting this out. And I feel very confident in the science that we have. I do know, like all others, I am concerned about the variants, but my practice has not changed. I wear my mask, I double mask. In the hospital, I do my 6 feet apart as best as I can, and I wash my hands. And I've always said that that's the public health part of me when I'm talking about to patients about COVID, that we should never let our guard down. Even being vaccinated, I still do exactly what our public health officials has said and has worked for us even before the vaccine.
Well, that's great, and I'm glad you said that, because I also have a background in biology too, and I was a lab technician, and I understand how research goes. And I was saying that to a patient yesterday. Why? She said they developed this thing so fast, and I said money. It's money. Typically, when you do research, you don't have money. If you have $1 million in your budget, you have to make sure you spend it so nicely so that you can actually, you don't try extravagant stuff. But now when you have millions and millions of dollars at your disposal, you can hire 50, 60, 70 people simultaneously to do that. And so that's one of the reasons that the vaccine was quickly developed. And so I'm glad you brought that up. And I wanted to, coming from you as, I mean, let's face it, as a young Black professional, a lot of our people don't take the vaccines because of past situations, things that have happened in the past. One of the things that I hear a lot is the Tuskegee Experiment, what they did to these airmen. And but one of the things that people don't understand or don't know is that, yes, the men were infected with the virus, but they were not given the vaccine. See, the vaccine, which was the antidote to the virus, was not given to the people. So it's not the vaccine that killed them. It's the virus that the government gave them, which was totally, wrong and despicable. So I want you to just talk to that again, so that the people in our community will understand that this thing, the antidote and the science behind it works, and all these conspiracy theories that are there, shed some light on that. So maybe somebody that is on the fence will say, you know what, if Dr. Janelle has taken it and is advocating, maybe I will. So maybe you can shed some light and help somebody cross the line.
Definitely. Whenever I talk with my patients or family members, I'm very respectful of people's decisions. And I always tell them that in the end, it's your decision to make, but I always want them to make an educated decision.
Absolutely.
And what I've seen is that, and I'm very honest about it, is that probably 60% of the patients who end up in the intensive care unit on a ventilator are patients who look like us. So they're Black, they have either comorbidities, meaning diabetes, lung disease, heart disease, some of them none. They're also first responders because they either work for the MBTA or they're doing cleaning services. They have to leave their home, and they also were not vaccinated. And COVID does not select who they want to go to, or who gets it, but it's the way the body reacts to it that's different.
That's right.
That's where the difference lies. I think that's what people don't understand. So my risk of COVID and someone else who does not look like me is the same. It's just that if I was to get it versus someone else who doesn't look like me, someone would probably bet on me getting it worse than, probably a Caucasian female my age. Okay, so a lot of the times that unfortunately, all people are being affected worse than other populations. And if you think there is discrepancy or sort of how we treat others, well, let's think about it. Where do we show up when we're looking for medical care? We don't show up to Boston, right? We live in certain communities. We show up to the smaller medical centers. And then we need to then if we're getting very, very sick, we know that need to try to get into the bigger medical centers. So that's another thing that's against us, actually, because we show up to the communities that serve us, right? So those are the things sometimes people don't think about. And when I talk about the vaccines, the vaccines are the efficacy of the vaccines. I always tell people, any vaccine you get does not prevent you from getting it. What it does is that it reduces the severity, how bad you get it. We know for a fact that people who get their COVID vaccines are less likely to get hospitalized, less likely to be seen in the ICU, less likely to be ventilated, and if that's the path you're going down, of course, less likely to die from COVID. But you can still get COVID. It's just that you're reducing your chances of getting it so severe to much less. And I just want people to know, because I feel like there is a lot of stigmatization of the Black community that they're not getting the vaccines. I want you to know that I have a lot of my patients who have gotten the vaccines, who look like me, who look like you, CJ. So I want people to know that we are getting the vaccines. It's just that we need to increase our numbers. And the first step is, if you have any questions, find somebody who has knowledge in this. I would stay away from Dr. Google and the internet and all the conspiracy theories, but actually turn to people you trust, your primary care doctors, people in the community who have gotten the vaccines and can speak to the vaccines.
Well said. And I want to go on record saying that I myself am vaccinated. My wife is vaccinated. My children are vaccinated. My mother is vaccinated. My siblings, I think most of them are vaccinated, if not all of them. And I would certainly not recommend anything that will hurt or harm my family. So if you are listening and you are on the fence, CB took it, and Dr. Janelle has taken it as well. And there are many in our community who have taken the vaccine, and it is good. And the sooner we all can vaccinate, the sooner we all can get together as a family. But I appreciate you saying all of that. But I still want to highlight the fact that you are doing awesome in your field. You are currently a professor, I believe. In all of what you're doing, you still teach at Harvard University. Tell us about that, and what do you teach?
So I hold an instructor of medicine appointment at Harvard Medical School. And I do teach the lung cancer course to the sort of first, second year medical students, because that's sort of my clinical interest. I should say more lung nodules, but I ended up doing the lung cancer course. I also, through my pulmonary clinic, work a lot with the trainees. So the medical students come to clinic to work with me. The residents also work with me, and I also supervise fellows. And I do the same when I'm in the ICU in Boston. So I supervise, the buck stops with me. I'm the attendant, I'm the captain of the ship. Everything rolls down to me. So usually I work with the residents. I have a fellow when I'm attending, and medical students. So we're constantly learning. And I tell people I learn more from them than they probably learn from me, because they're more on top of everything. And that's called an academic environment. So where everybody's learning from each other. We work very closely with nurses as well, and respiratory therapists when I'm in their intensive care unit. I also do some rotations out at Beth Israel Milton, where I work in the ICU, and I do have a pulmonary clinic there 1 or 2 Tuesdays a month. But when I work there, I work just with the nurses, and that's also a wonderful experience, because that's where I get to see a lot of people that from my community, and it's always nice because I have these little ladies coming up to me and say, "Oh my God, I can't believe you're Black, Dr. Baptiste." so those are some of the more rewarding experiences I have besides teaching those to come in the medical field.
Well, that's great. You come to Milton, my community. I'll come and look for you on one of those Tuesdays. All right. So that's awesome. And I am so proud of you and what you're doing. And what are some of the future aspirations you have? I know you say you want to retire in Dominica, so I probably need to go home and build a little place you can rent from me or something like that. But what are some of your future aspirations? We have a couple minutes.
I think for me, it's, more leadership, some more leadership positions. One of the biggest things that there is a lot of disparity in sort of lung cancer screening, and trying to become more a face for that. And that's just from my professional aspirations. I have 2 little kids, so I also want to invest more of my time in them and sort of bring them up. I also want to keep them grounded, like try to make them feel like. There was one point my daughter thought she was living in Dominica because we had a thinking like that until she started going to school. So I kind of want to pass that on to them as well, and try to get them back home whenever I can, because my dad is still on the island. And sort of expose them to the culture. Their father is very cultural. He speaks patois, which I don't. So he's introducing them to that as well. So I want to keep my kids grounded. That's important. And, just be open to whatever the world has left, whatever it's there to offer. I do hope that we come up, like all of you, I really hope that we come out of the pandemic soon, but that I really wish for all that we all come out of the pandemic sort of more knowledgeable, healthy, and with our loved ones. And that's my hope for everybody, that we make it through this. Well,
that is so great. And I'm so excited to know that. And time is coming by so quickly. And so, but I know that is great, and you setting a wonderful foundation for your children. I have met them; they're awesome kids. I've met your husband. Indeed, he's as Dominican as they get, and we speak our Creole when he does come by. So just before we sign off, I would like you to send some shout out to some people. I know your sister Kim might be watching. Your dad Isaac Baptist back in Dominica. Your mother Joanna. And your brother, what's his name again?
It's Irvin Baptist.
Irvin, the pilot. And so better tell Irvin I want him to be on my program. I'll try to reach out to him. Who else you want to send some shout out to? And then we will say goodbye and thank the Beacon Dental Group that sponsors our program. Yeah, so to everybody that's listening, first of all, to everybody that's listening, I don't really have any shout outs. I'm not a shout out person. I'm to my kids, Adalia and Braden, my husband Lonel, and to your viewers, and thank you for having me on. Please, if you have any questions about COVID, the COVID vaccine, reach out to CB or reach out to myself. I'm very down to earth. I speak. This is how I speak. This is how I speak to my patients, because passing on information, people need to understand. So I'm very happy to speak more about it, and have a wonderful rest of your day. Thank you so much. And again, thank you, all the audience, and thank you for your comments. I see a lot of Dominican people on. I know you're proud of Janelle, and so am I, Dr. Janelle Baptist. We are so proud of her. She's from our corner, and you listen to her and do what she says, because she'll never lead you astray. So again, from CBSCon, I want you to know that you're a star and you need to shine wherever you are. May God richly bless you. Thank Beacon Dental Group for a smile that light the world. Until next time, Janelle, it was nice having you, and hopefully we'll do this again. Have a wonderful day now. God bless.
Bye.
People say I've got a great smile. Well, I have to say, this is all thanks to the professional team at Beacon Dental Group right here in Dorchester, Massachusetts. I've got world-class dental care. Beacon Dental Group has expert and caring staff dedicated to providing the most advanced and satisfactory treatment in all aspects of oral health. Their services are designed to meet your needs and give you a perfect smile, too. General checkups, cosmetic surgery, Gemini laser service, and advanced procedures, all in a state-of-the-art facility. Call or visit Beacon Dental Group today, 1026 Blue Hill Avenue, Dorchester, Massachusetts, or call 617-282-2146 for a smile that lights the world.